I would argue we're probably the first in the US at least to assess cannabis use exposure at the level of nuance that we do.
So, that's the other thing is that each of us is different in different ways with, how we respond to medicine and compounds, and even caffeine or smoking pot or whatever, right?
If at all you are using cannabis, make sure that it is procured through the proper channel, because it makes a huge difference.
It's Reefer MEDness, the podcast with Trevor and Kirk.
Kirk, we're back.
How's it going, Trevor?
Good. I had a really nice chat with Dr. Vlad Gavril from Germany. It was amazing. He just kind of reached out to us on LinkedIn. I'll talk more about that later so we can listen to Dr. Vlad. But I was literally in Walmart buying foam to try to make my microphone less echoey. And suddenly a message came up, and a few things later, we had pretty much agreed on interviewing him. So that was just really cool. I don't usually have Thursdays off. I suddenly had a Thursday off and was getting messages from Germany, and it turned into an interview.
Yeah, and he's a fan of the podcast. He's been listening to us for 6 months, he said. That's kind of cool.
Yeah, fan of the show. So do you want to just get into him, and then we'll discuss? He had lots of interesting things to say, medical legalization, etc., and patients he's been treating. Want to talk about more of that when we come back out?
We should introduce ourselves. We're trying to get into that gig, right?
We do keep forgetting that. Okay, I'm Trevor Schufelt. I'm the pharmacist.
I'm Kirk Beckers. I'm the registered nurse, and welcome to Reefer MEDness, the podcast. You found us, and we tell stories about our learning in cannabis. So you're going to learn how we learn about cannabis. And this is actually an interesting episode because we just spent the last 15 minutes trying to educate ourselves on the laws in Germany, so that we could sound semi intelligent in this conversation.
Yeah, it's probably good we don't record everything we do, but yeah, we just spent a little bit of time Googling and whatnot about laws in Germany, but we'll talk about that on the way back up.
Yeah, let's go into the interview.
Yeah, hello. First of all, thank you for inviting me. It's really an honor to be here since I really enjoy your podcast. I'm a GP from Germany, and I'm listening to your podcast every week whenever there's a new episode since almost half a year now. Like I said, I'm a GP, but I'm focused on the treatment with cannabinoids. I'm interested in it since almost 6 years now. But I got my license 3 years back now. And since then, I'm prescribing also because before, of course, I was just consulting and I was not allowed to prescribe myself.
Okay. So what first got you interested in cannabis for patients? Often there's one patient who sort of gets people interested. Was it a single patient or what got you interested?
To be honest, no. It was one of my best friends back then. He started a wholesale company in Germany back in 2017, and then he started telling me more and more about cannabis. To be honest, I myself didn't have much contact with cannabis. I have a brother who, let's put it like this, he misused cannabis, so I was kind of negatively on it. But then he told me about the medical use of it. And then I started reading about it. And then when COVID hit, I really went deep into it. I contacted people from all over the world. I was talking to Raphael Meshulam. I was talking to Dustin Tulak, Mara Gordon. I just contacted them via LinkedIn. And we do now, we set up a meeting on Zoom. We talked, we exchanged ideas, and I got more and more interested. And then I decided for myself to focus on it because in Germany, unfortunately, we don't have many doctors who are we have more and more doctors prescribing it. But to be honest, in my opinion, not many doctors know a lot about it. So they prescribe it because patients are coming to their office. They are asking for it. And basically, patients are telling the doctors what they want to have on their prescription. And then the doctor just prescribes it, tells them to be careful, and that's it. So this was my aim to go in there in this niche, let's call it like this, and to like specialize in it, and to really also give like knowledge to the patients, because in my opinion, if you use cannabis properly, it's totally different than the recreational use. Then cannabis can really be a powerful tool.
Oh, that's very interesting. So let's talk a little bit about cannabis in Germany. So even if I didn't have a cannabis specialist like you, I could just go to my GP and say, I want some cannabis, and they could write me a prescription, or how does that usually work?
Yeah, basically, yeah, it's true. So when you get your license in Germany, it's called Approbation, this is the German term for it. As soon as you get it, then you back then, like till the partial legalization in Germany, which took place in April 2024, it was supposed to be given to a patient on a narcotics prescription, and these are really like doctors are really careful with them to issue them because of course there are a lot of risks and so on. But as soon as you get your license, you can apply basically to get those prescriptions, and you don't even have to have a medical training already, like in a clinic. You don't have to be a specialist doctor. You can prescribe them. Yeah.
Okay. And then as a patient with the prescription, what do I do? Do I walk down to my apotheca, my pharmacy, and get it? Does it mail to me? How do I get the cannabis after I've got the prescription?
So there are different kinds of ways. Many pharmacies by now, they are specialized on cannabis in Germany. So they have their normal day-to-day thing going on with whatever medication that you know. And then they have a separate website most of the time, which is like their cannabis department. And then you can order it and get it delivered to you via a DHL, for example. Or, of course, you can go to the doctor, take your original prescription, and then you go in person to the pharmacy. And then, of course, I like this more because then also from the pharmacist, you get a bit more of some education on how to take it properly and all this kind of stuff. Because, like I said in the beginning, we have a lot of telemedicine platforms. And the doctors there are, in my opinion, way too loose with issuing them. So the patients are not getting the education they need to use it properly.
Well, that's fascinating. So a regular pharmacy in Germany can have cannabis sort of sitting there besides the cholesterol pills and the antibiotics. It's allowed in pharmacies.
Yeah, it is allowed. They don't have it in the let's call it in the place where you go as a patient, as a client. They don't have it there on the shelf next to the normal other drugs, but they have it in their in their storage. And then when you go there and you give them the prescription, some of them they will issue you the cannabis really fast. In containers, I think the podcast is without video. But in these containers that you see here, okay. This is, for example, one, and then you get it and you can take it with you. But most of the pharmacies, they are really careful because of the smell and so on, because it's still let's say a field where most of the German people are really reluctant. They still have those stigma around that it's I don't know, a gateway drug and all this kind of stuff. So right. Many pharmacies, they see especially the economical value in it. So they do it out of reasons financially and so on. But they still want to have it separated from the normal day-to-day business in the pharmacy.
Okay. Are there recreational stores in Germany too? Like if I didn't have a prescription, can I walk into a recreational store and purchase cannabis, or is it just medical?
No, as I told you already, from April 2024, there was the partial legalization. It this was the pillar number 1. And they said there will be pillar number 2 or column. I don't know the English term to put it. Yeah, but they want to do they want to do it in 2 steps. So first step was the medical use, that it went out of the narcotic prescription sector. So every doctor could just issue it on a normal prescription. So it was way easier also for doctors to prescribe it. So the availability, the access for patients got way easier. Then a lot of telemedical platforms went in, and you can see it also on the numbers. They exploded when this happened in Germany. So, but if you just want to use cannabis for relaxation or whatever kind of reasons, recreational use, then the only possibility you have is to like grow it yourself at home. You are allowed in Germany per like household to have, I'm not sure if it's 2 or 3 plants per person or per household. But if you can't do this, the only way still in Germany is to have a doctor prescribing it to you. And then this is like a big discussion in Germany, because like the recreational and medical sectors are really like going into each other. Like there is no clear border. And this like, there are politicians who really criticize it and so on. And now there's also like in the German parliament, like a debate going on to change the laws again, because they say there's a lot of misuse.
Okay. So let's go now into your practice. That was fascinating what's going on in Germany. But so you specialize, we'll call it specialize in cannabis and patients. What do typical people come to you for that you're using cannabis to help them with? What sort of conditions are you treating with cannabis and cannabinoids?
So number one condition for sure is chronic pain, for whatever reason, like for sure back pain, but also like pain as a side symptom of other chronic illnesses. Then we have for sure insomnia, many patients with insomnia that are working like a shift system. Like we have many people working at big industry facilities that they work day and night shift, and then their whole circadian rhythm gets like disturbed. So they use cannabis for sleep aid before like going to benzos and other drugs. So they are really afraid of side effects. So they come to us as doctors, and then we give them medical cannabis. For sure, we have like the indications where also like the dronabinol, I think in America or like in Canada, it's called Marinol. It's the same, I believe. These ones are like, for example, for chemo-induced nausea and vomiting, to stimulate appetite. But like in my office, most of the patients come for chronic pain, insomnia, but also, and this for me especially is really important to mention this, for psychiatric disorders, for example, depression, ADHD, and so on. And there in Germany, we have like doctors who work in this like specialties, and they are really alarmed by it, because their experiences are with patients or users who misuse, and they end up in the psychiatry because they got a disorder from it. They're like, in my opinion, it's really important as doctors to step in there, because I ask myself, but why do they end up there? And in my opinion, it's because they don't find a doctor, they don't find anyone to talk to and tell them about how cannabis helps them. And then you can really check the terpene profile and so on, and give them a proper strain which helps them more. Because patients in Germany, a lot of them, they don't know anything about entourage effects and all these kinds of things. They know indica, they know sativa, and that's it. So most of them, not all of them. Like sometimes I'm surprised. Sometimes I have patients that they use cannabis for decades, and I'm honest, they know even more about cannabis than I do, because I am really deep into it since 6 years, I would say. But of course, like after using it for 30 years, and when you read about it, of course, your knowledge it's much broader. So I learn every day.
Oh no, that's fascinating. And I want to talk more about the mental health things, but just before I forget, how are most of your patients taking their cannabis? Are they smoking it? Are they vaping it? Are they eating gummies? Is there a way they get it into them the most often?
In Germany, it's not allowed to smoke medical cannabis.
Okay.
So because on the prescription we write to vape and inhale. So when you use a joint, you burn it. So it's not allowed. Then the patients also can get into trouble with police and so on when they are stopped and when they are asked. So like I instruct patients to get a vaporizer and to start vaping, because also there the temperature is much lower. So they get, like I always tell them, you get everything out of it, all the good and the bad, like the carcinogenic effects and so on are way less with vaporizing. For me, it's important to tell patients vaporizing isn't healthy, but it's healthier than smoking. Because like some doctors are telling patients vaping is really healthy for you and so on. So I'm really like, I really want to educate my patients correctly and don't tell them vaping is healthy, because I'm quite sure it's not. But I always do a risk, how do you call this? Risk benefit ratio.
Risk benefit. Yep.
Yeah, and then like I go for vaping, but I also try to show my patients the whole picture. So in Germany, we can prescribe flower, cannabis flower, which is to be weighed, and then we can also prescribe oil. And most of it we have in Germany is full spectrum oil. And there we have like different kinds of strengths, you say, like 10, 10, 25, 25, 25, 1, and so on, 51, 101, 100, 100, so many different. And this for me is really important, since in Germany, like the insurance companies are really reluctant to take the cost for cannabis if it's flower, because they say with flower it's really hard to reproduce the effects and so on. Okay. So for me as a doctor, I always like, you have to fill in a formula.
Form, yeah.
Form, and this is quite hard to get the insurance company to cover the cost. It's really just when you are basically, we have the guidelines and you have to fulfill the guidelines. And as a last resort, maybe they will pay for the cannabis therapy. With flower, impossible by now. So I try to tell my patients, try both, try flower and try oil. And then we will see which works for you the best. But in Germany, since the education for patients, it's really low, I would say. Most of the patients only know from also recreational use and so on, the vaping or / the smoking part.
Okay. So let's talk more about the mental health things, because it seems to come up in Canada lately a lot too. If someone had depression or anxiety and was coming to see you, maybe they're on an SSRI, maybe they're not. What has been working for your patients, or what sort of cannabinoids or terpenes? What have you been doing with them?
Yeah, so unfortunately in Germany, we don't get much information about the minor cannabinoids. We get as doctors, I can see a certificate of analysis, but there I only get the THC, the CBD content, and the terpenes, but not the CBN, CBG, and all the other cannabinoids. So I really look forward to, because I believe for sure also minor cannabinoids are really important. But like I go especially for the terpene profile. So to patients that, let's say, like it's depression with in the morning, with like a lack of energy, you just want to stay in bed and all this kind of stuff. Then I would go for terpenes, which are like more in the which give you the feeling of like getting energy. But like I don't want to put it like you take the cannabis and then boom, you are like totally energized and you are happy and so on. But with time, I believe that what my patients are also like telling me, when you choose the right strain with the right terpene profile, and it's really, really individual. but I go like for limonene, for terpenoline, for like those kinds of terpenes. Then they see that they are like getting out of bed more easy. They get motivated again. And then you can start like doing a bit of sport, because for me, it's also really important to tell my patients, you have this endocannabinoid system in you. Okay. And there are also, again, two like pillars. One is the endogenous part, which we have, which we can like activate by doing stuff like meditation, yoga, sport, going for a run, and all this kind of stuff. But when you are depressed, and unfortunately, I know how it is to be depressed because I myself suffer from depression in my life. So then it's really, really hard to get the motivation to go for a run. So I tell them, like, we will introduce cannabis, we will get your endocannabinoid system activated. But when you get again to this point where you feel a bit of more motivation, then it's really important for you to take this motivation and to go for a run. So you have like both systems, both parts like activated, the endogenous one, and of course, exogenously, you can add the cannabinoids, the phytocannabinoids, and they also work on your receptors. And when you tell the patient that it works like this, then they understand it more properly, and then they also see it as medicine. I believe, like, that's my experience in the years since I do cannabis. Many patients still don't see it really as medicine. They see it as something that helps them, but not as real medicine. Like something like more like herbal medicine. But in Germany, like, unfortunately, many people don't think like really highly about herbal medicine or like other ways of medicine. Like it's more like concentrated on Western medicine. On you have a symptom, you give a drug, then you're fine. But like I use also cannabis, I always tell my patients, before you take it, also put yourself an intention. Why do you use it? What do you want to achieve by using it? And like this, I believe the use is more conscious, and then also misuse happens way less. That's at least my experience.
No, that blends really well with some of the other people we've been talking to about mindset before they use it, and yeah, no, we've come across that a lot lately about being in the right frame of mind and what you're trying to get out of it ahead of time. So no, that's fascinating.
It's Renee here back in the studio. That's where we're going to pause the conversation with Dr. Vlad Gavril. And we're going to continue that conversation, well, Trevor is, next week in part 2. And then Trevor and Kirk are going to add their insights and analysis into what was discussed. But that's all in the next episode of Reefer MEDness, the podcast.
Check out the complete library of Reefer MEDness episodes at reefermed.ca. And make sure to follow us on all the socials for bonus info on what Trevor and Kirk are up to.